Pavlakis, we're hearing something about a thing called Tourette Syndrome. What is Tourette Syndrome?
Tourette's is a compulsive motor movement, a tic. Typically will present as a blink. And if one also has a compulsive voice, like a grunt or a squeaky voice, or some people think swearing, that would be a compulsive voice. And if you have both of those for a year, it's called Tourette.
But the trick is it has to be there for
a whole year. Now, the key thing to know about Tourette, this too is genetic, that it's very common. It's much more common than anybody knows. The other key thing to know is that most children that have Tourette, a lot of them outgrow it, and most children really aren't terribly affected by it. In other words, do very well and go on and become president of companies and what have you. And the great majority of children do not need treatment for Tourette. There are medications for it, but the great majority do not need to be on medication for Tourette. Children with Tourette do not need tests. They need to be looked at in terms of associated problems, because patients with Tourette's are more likely to have ADHD, obsessive compulsive disorders, learning disabilities, and depression, but they need not have those things.
Are there any medications, if you do have Tourette's and it's obviously affecting the way they function, to help?
Yes, there are medications that can diminish the tics. Now, tics, just like ADHD, in my estimation, should not be treated unless they affect the child academically, socially, or sometimes tics actually hurt physically because you're blinking so much it hurts your eyes. In those situations, one can consider medications. And the typical first-line medication with probably the best safety profile is clonidine or Catapres, which is a blood pressure medication. After that, people sometimes use major tranquilizers, which have a little bit of a worse safety profile. But again, I want to stress that most people with tics or Tourette's have a relatively easy course, and it doesn't affect their life terribly much. This is one of those situations that one has to be very careful about what's on the internet. For example, there's a lot of information on the internet about Tourette's, and it's all very good information. There's a Tourette's Association. It's a wonderful organization. But if you read what they have to say, they're talking about the 1% of patients that are very severely impaired. And parents very often will go right to that and say, oh my goodness, my child has this horrible disorder. And the reality is most patients that have Tourette's have a very mild course and don't even need medication and do perfectly well in life and very often outgrow it.
There's a condition they call a benign habit tic. What is that?
I'm not sure what that is. A benign tic is just a tic. And if you have a tic without voices, without noises for a year, we call it a tic disorder. Again, there's a real overlap between Tourette and tic disorder. I personally think they're the same, but we don't know because we haven't found, again, not it's not my research interest, but no one's found a gene for Tourette or tic disorder. Maybe the same.
Some kids get blinking, they're in school under a little bit of stress and it goes away. That's not related to this, is it?
Well, that's a tic, and it's probably part of the spectrum, and I think a lot of us, and I think I sometimes blink too much too, and that may as well be a tic, and that's why one can't get too terribly worried about this stuff.
Thank you.